Hi everyone, this is Dr. Rajni, gynecologist, laparoscopic surgeon from Care Vatsalya Women and Child Institute Care Hospital, Bandara Hills. Today we are going to talk about painless labor. What is this painless labor? So, delivery without labor pains. Previously, we had this painless labor in terms of cesarean section. Whenever a woman opts or a woman is delivered by a cesarean section, we give spinal anesthesia so that the lower part of the body will become numb and patient will not have any pain. But in the past few years, there are a lot of technological advances have come wherein there is a process of painless normal vaginal delivery. So in this process, what we do is we call the anesthetist. Whenever a woman is having labor pains, once she sets into labor when she is approximately 3 centimeters dilated, then we go ahead with this epidural anesthesia. The anesthetist is called and there is a catheter introduced into the epidural space so that he'll give a medication bolus which is going to block the nerves which cause pain in the lower part, that is the abdominal thing. So after taking this epidural analgesia, mostly 70 to 80% pain is relieved to the mother. So she would be having little bit of discomfort and she won't be able to feel this labor pain so that she can focus more onto her pushing of the baby. So there are lots of advantages and little bit of not many but little bit of maybe side effects may be there with epidural analgesia, but the advantages definitely overweigh the risks. So advantages are that she can focus more on her labor this thing, and the recovery is faster, and because absent of pain she can take good deep breaths so that the oxygenation to the baby is good. So sometimes what happens is after this epidural analgesia, when we are trying for normal vaginal delivery, there may be chances that we can take her to cesarean section. In such conditions, because she is already having epidural analgesia, shifting to OT and doing a cesarean would be faster. So there is no need of again going for a spinal anesthesia. We can go ahead with this epidural and go ahead with cesarean section also. There are certain risks associated with this, very negligible. One, very few patients, they may have prolonged labor because of this epidural. Sometimes baby head, there will be full dilatation, but the baby may not come out of the vagina. In such situations, the mother, we may have to put on instrumental delivery. may have to go ahead with instrumental delivery with forceps or vacuum. So definitely the comfort zone is more with epidural analgesia. Patient can focus more on her labor this thing, and once epidural analgesia is given, usually it acts on 3 to 4 hours. But if we want the analgesia for a long time, then also we can adjust the doses accordingly. So the bolus will be given, so accordingly the dose is adjusted, and so that even in the post delivery period also, patient will be at comfort so that she will not have that much amount of pain. So in the previous generations compared to the present they were our grandmother's time and all, they used to tolerate this pain more, and more number of vaginal deliveries used to happen. But the present generation, we see most of the women, they are not much tolerant to the pain, so they keep asking us to do cesarean sections. So my advice to the ladies out there who are preemies or the first time pregnant ladies, make yourself mentally strong from the first day of pregnancy, that if you want a normal delivery, you have to be mentally strong and you should be very physically active. So indulge yourself in some sort of exercise, physical activity. Eat well, but don't overeat. Avoid much of carbs, avoid sugary items, don't put on too much of weight. Go for regular antenatal checkups. Monitor your BP, sugar levels, keep everything under control so that you can opt for painless vaginal delivery, so that more number of vaginal deliveries will happen compared to C-sections.